Good evening, everybody. Welcome to Call the Doctor. Pretty soon on the screen there'll be a number for you to call to remind you that if you have questions of either I, or my co-host Gene Kitchen, or our guest Dr. Lee Isley today, who we'll introduce officially in a minute, please call the number and ask your question. It's a live call-in show, and so please take advantage of that. You know that we've spent a ton of time blowing up the benefits of the hospital and our community, Nash UNC Healthcare. Today, not only is my co-host, who's a member of the board of the hospital, going to help guide us through some of the information we were going to introduce, but we have as our illustrious guest Dr. Lee Isley, who's the president and CEO of the hospital. And so our hospital is community owned. It is not part of the UNC system. Formally, it's really owned and operated by our community. And in doing so, the management of this hospital is accomplished by a board, which Gene will tell us about in a second. And then we'll introduce Dr. Isley, who will explain to us what the role of the president and the CEO of the hospital do. So Gene, tell us a little bit about what the board does at the hospital.
Okay, we have got a board of 14 now, I believe, right, Dr. Isley?
Yes, ma'am.
It was 12 for a while, but now it's 14. In fact, one of our board members is a county commissioner, Sue Leggett, but it's a wonderful board, and of all the various, and you know I like volunteer work that I've been on, it's the best board I have ever served on because the skill set, the amount of time that people are willing to give because they care deeply about our healthcare system is tremendous. And we meet quite frequently. We have subcommittees that we break out and work, but we help steer and guide, and Dr. Isley's very, very gracious about leaning or looking to us for wisdom and guidance and input, whether it's the financial, the quality measures, the strategic planning. We are kind of his eyes and ears in the community, the hospital's eyes and ears.
And you really represent the community. Tell us a little bit about that.
We come from all counties. We are represented by all counties in Nash County, male, female, diverse in every way, and diverse in age, diverse in ethnicity. But we all feel very free. We are all on committees, as well as serving on the board, and we meet the first Thursday of each month. And we always have a representative from Chapel Hill, from UNC, usually Dr. Alan Stiles. But you mentioned we are partnered with UNC, but not owned by them. And a number, and Dr. Isley will explain it, but a lot of the hospitals were purchased and are owned by UNC. But a board prior to the board, my serving on the board, elected that we wanted to partner with them. And he'll very gladly tell you all the wonderful benefits of that, but I mean, we still are Nash County started us.
Because what we've been advancing with every single show that we've done is how the hospital serves our community in many ways, and we're really going to get into details on that tonight. But it also, it's clearly has investment by our community and a broad spectrum of our community to help guide the administration of it, and I think that's an important point.